and welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, we are doing part 2 of our Donate Life series. April is Donate Life Month, and on today's episode, this is a 2-part interview. At the beginning of the episode, I will be talking to Bob Arrington. He is the founder, president, funeral director, and embalmer for Arrington Funeral Directors. He is a past president of the National Funeral Directors Association, and he is an advisory board member for Tennessee Donor Services. And in the second half of this episode, I will be interviewing Sean Kimmins. He is a kidney recipient and a licensed funeral director and embalmer for Stevenson Shaw Funeral Home. Welcome to the show, Bob.
Well, thank you. I'm glad to be here.
So say you've got a long list of things you've been doing over the years.
Well, I learn by doing, and I kind of follow people around that can teach me something.
Right. Well, thank you so much for being on the show today. So for Donate Life Month, wanted to kind of talk to you about how it affects you being in the funeral business. So I want to say, how long have you been in the funeral industry?
Well, I started hanging around funeral service when I was 7. Grew up in Milan. My next door neighbor owned the funeral home. I'm a first generation funeral director. I started a funeral home. I didn't get it from my father, grandfather, great grandfather, because usually funeral service is a family business.
Right.
But I got interested in it when my grandmother died, and then we moved to Jackson in 1970. I went to work for a local funeral home. I've always wanted to be in funeral service. That's all I've ever known, really, that. And I was in insurance for a little while. But as things started growing north, all the funeral homes were downtown, and I said, I want to start a funeral home. And this was in 1993 when this all started in my head. And I said, we need a funeral home built for a funeral home, not an older house added on to in the north part of town where people live. So in 95, we opened, be 29 years in June. And so we were out there on University Parkway, and there wasn't anybody around. Nobody knew that street. University Parkway was actually Oil Well off the bypass because it changed name to Homeboat Road. But anyway, it's just something that I've always wanted to do, kind of somewhat of a calling, I think.
Okay, yeah.
I was in it and got out of it, and I missed it and got an opportunity to get back in it. And so that's what we've been doing since 95.
Sure. And that's over there by the Fancy Kroger, right?
Yeah.
Well, you didn't used to be anything. Now it's Fancy Kroger.
That's it, yeah. And it's across from the North Post Office.
Right.
Right down from Northside High School.
Great, yes. So that's great to have that up there. For that
it's
to be
worked
kind
well
of a
out in the
you.
north part of town.
Yeah. Let me ask you this now, too. So how are funeral directors involved in the organ donation process?
How we get involved, obviously, is once death occurs, we'll say in a facility like Jackson Madison County General Hospital, then TDS will reach out and have those visits if they're not a registered donor. Because, now maybe 50% of Tennesseans are already registered on the back of their driver's license. But TDS reaches out, and then, of course, we're all doing the same thing. We're serving families.
Right.
My whole thing is you got the funeral director, Tennessee Donor Services, and the hospital with this 3-legged stool, and the family sitting on top of it. So we're all three in this together to serve families for the betterment of whatever that family wants or the deceased wants, especially if they're a registered donor, to be able to continue and to give life after you die. So we work with Tennessee Donor Services and the families as somewhat of that conduit, because usually if they are a donor, especially an organ donor, it may take some period of time before we can actually get the remains to be able to schedule a funeral and do those. So we work with Tennessee donors and the families to help coordinate all of those things together to help the family. Basically, us and Tennessee Donors is all about the family.
Right. Now, are you aware if there's any funeral directors who are resistant or unsupportive of donation? And if so, why would you think that would be?
Yeah, there are. And I started working with donor services, it's probably been 10 or 12 years ago, because there was a lot of conversation and negative talk with the funeral directors and Tennessee Donor Services and families, because in all honesty, what it did is it may delay the funeral director doing something. And it was all strictly a personal thing. Well, this is interfering with what I do. This is interfering with
like
my
a business
schedule. Yeah. And it was usually that older generation funeral director that donor services wasn't involved as much 20 years ago as it is now.
And maybe they didn't know so much about it.
They didn't know anything about it. All they knew was what they'd been told by their granddaddy.
Yeah.
And they hadn't been educated.
Right.
So we started with Tennessee Donor Services and the Tennessee Funeral Directors Association a process to communicate with each other, thus communicating to the Tennessee funeral directors. We listened to the negative of the problems, and it was all basically communication.
Right,
I mean, that's it. Because when you get down to it, all the funeral director wants to know is where is the deceased?
Yeah.
Because all the family wants to know is why don't you have my daddy? Mm-hmm. My daddy died 4 hours ago. And so all the funeral director wants to know from Tennessee Donor Service is just let us know what the deal is. Okay, he is going to be a donor. We're going to take him to Nashville. We're going to do the recovery this afternoon. You'll be able to get him in the morning. That way a family member calls, say, here's the deal. Right. I know where he is. I know what's going on. We're going to have him in the morning. Right. So we started working really hard to bridge that gap of communication because that's why a lot of funeral directors were not a big supporter of donor services because they were left in the dark a lot and they got asked questions that they couldn't answer.
Right.
Where's my daddy? I don't know. That's the last thing a funeral director wants to tell a family member.
Exactly.
I don't know where your daddy is. So it's been an education process over the last 10 or 12 years, but more and more funeral directors being educated are understanding that families want to participate in donation, and now they're helping them.
Right. Yeah. And I mean, in any part of your life, having information, whether it's a great situation or a bad situation, not knowing is the hardest part. So it is so important to have the information. So, I mean, that kind of brings it to say how important is it for funeral directors to support donation?
Very much so. Because especially in what we started doing at our place about 6 or 7 years ago is people do a lot of pre-planning. So they pre-arrange their funeral. A lot of them pay for it. Some don't. But the main thing is put pen to paper, put the plan in place. Then we started asking about donation. That way, if a death occurs and we pull a pre-arrangement file, we know if they're a donor or not. So we go into the process knowing the conversation to have with the next of kin. Right. So, this was prearranged 5 years ago, but I noticed he's a donor and we know the process. So that way, going into the situation to try to help a family, we know what the process is going to be. Because a lot of times, daddy may have signed up to be a donor. The daughter didn't know it.
Oh, yeah.
So she sure doesn't know the process. So now the funeral director becomes the person with the information serving that family better.
Right, yeah. So that's a big
plus.
I would say, that's
plus.
Right.
Yeah.
So I know, and this is something that's a common myth, and we definitely want to get this out to as many people as possible, try to keep spreading this information. One of the most common myths surrounding donation is that the donor can't have an open casket viewing. Can you address that
That
for
is
us?
a big myth. That came from those funeral directors back several years ago that were against donation because, in all honesty, there is a little more work in the embalming and the preparation if they're a donor, whether they be a tissue donor, organ donor, whatever. There is extra steps that takes a little extra time. So a lot of those funeral directors just didn't want to do that. We don't want to work that hard. So as a result, in all honesty, funeral directors years ago would say, well, if he's a donor, you can't see him.
Oh, they just didn't want to.
The funeral director started that back years and years ago because the public wouldn't know that. But that's just not true.
Right. Yes, so in this day and age, it's like
you can definitely have open casket after donation.
Right, yeah. And so having worked with families whose loved ones were donors, are those families comforted knowing that their loved one became a donor?
Yes. Just because of it's that step of being able to have that life continue on. I mean, just think about the peace somebody would have, especially in a young death, tragic death, that somebody's heart, kidney, eyes, lung, whatever can continue on for another 40 or 50 years. So it's very warming to a family that it's just not completely over.
Right.
That my son will continue to live in maybe even 2 or 3 people.
Exactly.
So it's just an absolute pleasure to be able to sit with families and have those conversations, to be able to say that they're going to live on. And what we do is we set up a donor table.
Okay.
We fly a donor flag on our flagpole when there's a donor.
Yeah, that's great.
Because that way families usually want people to know that their son was a donor and to try to educate and encourage other people to do what he did.
Exactly.
So we help families promote that because it is so peaceful for those families to know that.
Exactly. And it is a situation where that person can affect more than just one other person's life.
Absolutely.
After the fact, right.
Absolutely.
So Arrington Funeral Directors became the first donation champion funeral home in Tennessee. Why don't you tell us a little bit about that?
Well, that was a program that TDS started back several years ago, which came out of this partnership between Tennessee Funeral Directors and Tennessee Donor Services as we began to partner with funeral homes that do like what we do, and that we help families promote donation on behalf of their family member to, say, the visitors at the funeral home, either through a visitation or to a funeral, that we let people know that this family participated in donation and this is why, and this is how you can do it. So we are champions for donor services, and we have resource information at those funerals to help promote and educate people on the influences of donation.
Sure, yeah. And, I mentioned at the top, you also serve on the advisory board of Tennessee Donor Services. So why would you say it's important for you to promote organ donation as a funeral director?
Well, because knowing what I know by working with Tennessee Donor Services, the importance of it and what it does and how many lives it saves and the difference it makes. And just by seeing all of the results of donation and the calm and the peace that these families have, that their loved one is contributing to the betterment of lives. In some cases, people they don't ever even know.
Right.
Their paths never cross. But to just be able to know, and I've got friends of mine that's received heart valves or skin from a burn, and they don't understand the importance of donation till they need it.
Right.
And then when you say, well, didn't your mother receive it? Well, yeah, that was because somebody donated through Tennessee Donor Services. So funeral directors see it firsthand, both in the need and the results, and by being able to help families through the process by participating in donation.
Right. Yeah. Well, West Tennessee is very lucky to have you because, within your role as a funeral director, you're not only on the business side, but you're also on the family side, on the promotion side, on the education side. So it's very, very good to have you.
Thank you.
Very great to have this conversation and spread some more information about Tennessee Donor Services and
yeah, I would encourage people to at least do one thing, and that's at least check in to donation. It may or may not be for you or your family, but I say at least check into it, because most people will sit down and realize I can make a difference, one person at a time.
Right. Well, thank you so much for coming on with me and talking to me about this and spreading this information around.
Thanks for having me, and thanks for what you're doing.
Great. Thank you so much. And we're back for the second half of our interview. We are talking with Sean Kimmins now, the licensed funeral director and embalmer with Stevenson Shaw Funeral Home. And he is also a kidney donation recipient, and he received his kidney through a living donor. Welcome to the show, Sean.
Yeah, good afternoon.
Thanks for coming on with us. So first, I want to talk to you about your profession. You're a licensed funeral director and embalmer. How long have you been in the funeral industry?
I'm actually been in the business a little over 30 years, but I actually grew up here at Stevenson Shaw as a kid. My father has been here since 1974, so me and along with my brother, we pretty much grew up in this place.
Right.
So that kind of, given me the inspiration to do what I'm doing. And I went into mortician school right out of high school and been pretty much doing it ever since.
Great. Yeah. So it was a family thing. Do you feel like even as a kid, you knew that this is what you wanted to grow up and be?
Oh, absolutely.
Great. Now, as a funeral director, how important is it for you, for funeral directors, to support organ donation?
It's very important. The way I see it, being a recipient of an organ donation, you're helping other people's lives. It is true enough, it is a process to lead up to that. And I don't discourage anyone to not do it, because you're really helping people that have just suffered or in lack of a better term, through illness, waiting for any kind of transplant. So I totally encourage that.
Right, right. Now, I'll go ahead and share this information that we've gotten from Tennessee Donor Services, that in Tennessee, African Americans account for 46% of patients who are waiting for an organ, and most of them are waiting for a kidney. But only 9% of those that have registered to be an organ donor are African American. What would you think? What do you think are some of the cultural barriers to African Americans signing up to be organ donors?
Well, as me seeing the African American community that goes through that, some of it is fear. And it's fear of, it's more like a what if. What would happen after the transplant? Am I going to keep this kidney forever? What happens if something goes wrong? And that's kind of I'd say problem, but it's the fear of what if. And that's why a lot of the African American community is afraid to get it done, because they never know what's going to happen later. As myself, I've had my kidney transplant. Come June of this year, be 13 years, and I'm blessed. I'm blessed to have what I have, and I'm blessed to the one that gave her kidney to me, so I could have a better life.
Right. And I know that one of the big myths is if you are an organ donor that potentially, life-saving measures won't be done as much on you, and that's absolutely not true. That's couldn't be farther from the truth.
Right, that is totally untrue.
Right. So you've kind of mentioned so far that you, we said you are a kidney recipient, and you said it's been 10 years?
Oh, it'd be 13 years.
Oh, 13. Great. So maybe tell me a little bit about how that started and the story there.
Okay, January of 2009, I fell ill around that time, and wound up being hospitalized for it. Mm-hmm. And next thing I know, it was told that my left kidney was damaged, and what caused it was my high blood pressure. Mm-hmm. And I was diagnosed with high blood pressure at 23. So at the time, I think I was 32 or 33 at the time when that happened, and wound up going on dialysis. And that's just a total process in life that I hate that people go through, because I went through it.
Right.
But that's something that has to be done in order for you to pretty much live. Mm-hmm. And so from January 2009 up to June of 2011, I was on dialysis, but I had a young lady that I grew up in church with, gave me a phone call one day and asked, what is the process of getting a kidney? And I told her, I said, well, as of now, I'm on a waiting list, not knowing how long I'm going to be on the list. And we hung up, never spoke of it again until like a couple of days later, I got a phone call that she contacted Vanderbilt in Nashville and said that she wanted to be a donor. Well, at the time when she wanted to be a donor, me and her both went through the testing for the donation, but she wound up being declined because she was a borderline diabetic. Mm. But that didn't stop her.
Right.
So at that point, Zumba was starting to get big at the time, and she was a Zumba instructor. So she started doing quite a bit of Zumba classes and lost some weight, started eating healthy to bring down that borderline of being a diabetic.
Right.
And tried it again a year later, and it was a go from that point.
Awesome.
And June 29th of 2011 was my very last day of dialysis, and I've gotten my transplant the very next day.
Awesome. That is fantastic. And I mean, her being a donor, that not only helped her, it sounds like, but it also, helped you. And that's a good thing about kidney donation is that, you can have living donors for those.
Right. Exactly.
So in terms of, how did this donation transform your life? You said you were on dialysis. What has been the process since then? Has your quality of life improved?
Oh, totally improved. I have more energy now compared to being on dialysis, and it's just been great. Keeping up with my regular doctor visits and checkup, taking the medications exactly how they tell me to take it,
right.
and everything is pretty much fine from there.
Great, yes. So as your profession as a funeral director and as a kidney recipient, what would you say to someone who's maybe not sure about organ donation or wanting to get some more information about that?
Well, for one, don't let it be a discouragement.
Mm-hmm.
If it's something that they have in their mind to do, there's no harm to do research, because anything or something of that magnitude that people want answers, and it doesn't hurt to ask questions about that, because it is a major surgery and there's a process, and you also, once the donation is done, that the person that's being the recipient, that is some steps you have to take after the fact, that to make sure everything is functioning well. If the doctor says to do this, you have to do it, and you can't really lack or slack on anything they tell you to do,
right? Yeah,
for you to have a better life,
right? And I mean, it's all about helping people, and I think that's such a great thing for those who are organ donors, living donors. It's such a blessing for those who are needing something, and the quality of life going forward is what's most important.
Right.
Well, thank you so much, Sean, for coming on and telling us your story. This was a great testimony for what it's like and the improvement of life that it can give someone. All right. Well, thank you so much for coming on. I'm so glad we got to talk to you and hear about your story there. And hopefully this podcast will help get that message out to more people.
Thank you so very much.
Thank you. Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.